A 13-year-old actress died after suffering a massive asthma attack. Laurel Griggs has been on Broadway since she was 6. Her father says she had asthma for the last 2 years and went months at a time without any issues. Many expressed shock that a common lung condition can turn deadly. To learn more, let's send things over to Lauren.
Thank you, Bridget. It's exactly what you just said, a common lung condition we've all heard of, but what a lot of us probably haven't heard before is that it can turn deadly. Joining me now in studio is Dr. Chung Rong Lin with the Queens Medical Center. Doctor, thank you for joining us.
Thank you for having me.
Is it rare for someone to die of a severe asthma attack?
It is rare, but not uncommon for something that is treatable.
Okay. First of all, what is asthma and what are the signs that someone may have it?
Sure. So asthma is a condition that causes your airways to constrict and makes it harder to breathe. There's also an underlying inflammation. We're not really sure why it happens in certain patients. What common signs are usually coughing, intermittent coughing, shortness of breath, chest tightness, and the symptoms tend to be worse at night.
Okay, and what's the severity, the range of an asthma attack?
Yeah, and asthma by definition is variable. You have symptoms that vary from month to month and day to day. But when they happen more close together and they're not being treated by the usual medications that you take, that is something to take note of, and you really should seek help at that point.
Let's talk about the signs when an asthma attack is so severe that it's good for parents to know that it's time to take their child to the ER.
Right. So as we know, asthma usually happens, it's an underlying predisposition to get shortness of breath. So many times patients with asthma have medications that they should take. So if they are using their usual medications and it's not helping, or if they're not even able to speak, or if they're having problems getting the breathing that's difficult and fast, where then definitely they should seek help.
Okay.
Yeah.
Now, if a child has asthma, does that mean they should not participate in any particular extracurriculars?
No, actually that's not true. If asthma that's well controlled, they should definitely participate in any activity that would help them improve their physical and mental health.
Okay,
Yeah.
so physical activities are good for someone with asthma?
Especially if it's well controlled. Yeah,
okay.
Yeah, that's right.
Any other tips that you want parents to be aware of?
Yeah, so I think many parents don't realize that asthma is an inflammatory condition. So many times there are two types of medications that we prescribe. There is a reliever, which is it makes the patient feel better immediately, but then there are the controllers where we give them to control the underlying inflammation. So it is important to take those medications, the controllers, to remove and reduce the inflammation and not just focus on the relievers, which make you feel good.
I know we've been talking about children, but is asthma something that maybe can develop over time? And let's say adults watching had no idea they have it, but they're listening to some of the symptoms you're listing off.
Absolutely, and actually we're finding an increased incidence in asthma in adults, and sometimes it actually is even more severe in adults.
Okay.
So if you have a recurrent cough, you have shortness of breath that's not explained, you're going on a hike and you say, hey, this is just not, I'm feeling a lot worse than I usually should, these are symptoms that you should probably prompt you to go seek help and get it checked out.
Get checked.
Yeah.
Thank you so much, doctor, for joining us in
My
studio.
pleasure.
Bridget, back to you.